All right, we're back in Senate Judiciary going over S-72, and we have Jeff from the Vermont Growers Association with us. Jeff, are you, can you hear us?
Good morning.
Morning.
Excellent. Can you guys see me and hear me okay?
Yes.
Thank you. Sorry about that. I was trying to time my break with you guys.
No problem.
It is a pleasure to be in this committee again. I want to thank everybody. I hope everyone is very well. And I appreciate you taking the time to discuss this important matter. For the record, my name is Jeffrey Pizzatello. I am the executive director and co-founder of the Vermont Growers Association. Though we have growers in our name, we do represent the entire supply chain. Our dues-paying members include retailers, product manufacturers, in addition to cultivators and ancillary businesses that are non-plant touching, for instance, security companies and insurance companies and whatnot. So that is our capacity here in committee, speaking on behalf of our members and the industry. I'll also add, for those that are unfamiliar, Vermont Growers Association, we are very appreciative to be founding members of the Vermont Cannabis Equity Coalition as well. And that coalition includes other member-based nonprofits in Vermont, notably the Vermont Racial Justice Alliance, Justice for All, NOFA Vermont, the Green Mountain Patients Alliance, and Rural Vermont, in addition to us as well. And we think that's important because really our coalition reflects the intersectionality of cannabis itself, whether it's criminal justice, racial justice, the environment, agriculture, more than just industry, in addition to public health. And beyond the interstate market, I just want to take a moment to share that we are also very appreciative and humbled to have been founding members of a national craft cannabis coalition over the past year since I have been in this committee last. That coalition is now called the National Craft Cannabis Coalition, and we consist of member-based trade associations across the country that have come together to advocate for small farms and small businesses and our intrastate markets in Washington, D.C. This past year, we introduced the first piece of federal legislation in this country for cannabis reform that includes and seeks to protect small farms and small businesses when the federal government inevitably moves towards legalization. I say all of this as context for the subject matter today. We have, through the National Craft Cannabis Coalition, here in Vermont, VGA, we have our finger on the pulse of what's happening across the state. And through an intimate door, we work side by side with the trade associations representing small farms and small businesses throughout the country. So I want to share some of that insight and experience that I've learned from over the year working closely with other states with regards to THC caps and this issue at hand. I am also here representing our local industry, and I do want to share that we support S-72 and the policy to remove the solid concentrate. We want to make clear that this cap, as it stands now, is having a significant and substantial impact on the market, on licensees, on small businesses throughout the state, up and down the supply chain, from the cultivators who supply the cannabis flower to manufacturers to produce these products, to the retailers and distributors who would be involved. So it is pertinent that I impart on you today that the entire supply chain, including customers, are being impacted by this policy. Removing it would have an exponential value on the market, and not just from a monetary perspective. I'll give you one anecdote. We have product manufacturers in this state who are reluctant to join the market if they find that their product that they produce, their craft product, is effectively prohibited. So the past previous witnesses have mentioned concerns around transitioning the legacy market and how other states have effectively failed to demonstrate the transitioning the legacy market and have attributed falsely, we add, the THC cap to, or not having a THC cap in those states, to not being able to transition. So we just want to say there are several factors in a regulated market that would make the legacy market transition. Things like access to land, capital, licensing fees. Those are more material than whether or not concentrates are allowed to be sold on the market. So we just want to say that, that statement is disingenuous at best. The availability of concentrates in the market, I'll also add, has little to no bearing on public health. And this was made evident by the December 30th report that the CCB had put forward. Vermont is not the only state to be deliberating this. We have about 20 states now with an adult use market. Vermont was the very first state, as we know, to put forward this novel idea. I want to impart on you, despite what you may have heard, there is no trend, there is no larger movement to prohibit these high THC products in this country, period. I want to say that again. There is no trend, there is no movement, there is no direction in legal states to step backwards and pull these products from the market and effectively tying the hands of our agency. And that's what you heard Chair Pepper speak to earlier today, is really where we're coming from and where the market is coming from is it is of the public's interest from not just a product standpoint, but also from a public health standpoint, to ensure that the state is regulating all of these products. So, and that is underscored by, this is not a new issue. We have petitions that have been going in Vermont over the past couple of years that have now earned over 1,000 signatures. These are both consumers and businesses. And there are over 200 businesses that sign these petitions. And so this is an important issue for Vermont. I just want to impart, oh, I'm sorry, go ahead.
Oh, no, you're fine.
Okay. And that's really all that I have. I am also here. I want to be brief, but I just want to say I'm also here to answer any questions, to be used as a resource. We understand that cannabis, let alone the issue of concentrates, is a complex subject matter. It can be challenging to understand. So please feel free to ask us any questions, and we'll be happy to demystify this subject matter if need be. Thank you.
I do have some questions. This is something I'm still trying to learn a lot about, and I want to make sure I get as much information as I can from different angles. We previously heard about a mental health impact. What I heard from you, and please correct me if I'm wrong, is that there is no impact on public health. And what I'd like to hear from you are your thoughts on the correlation or lack of correlation between states that have removed the cap and increases in mental health issues. Do you have any information or thoughts on that?
Thanks for asking that question. Our response would be in alignment with the December 30th report from the CCB. And that really rests, I believe Massachusetts may have said it best, while there could be concern and there could be correlations between some of these compounds, the science is not settled. The science is not settled. The body of evidence is not there. And so as a result, Massachusetts and other states did not move forward, did not advance this issue based upon the evidence and the studies that they went through. So I would respond by saying, without having, without having studies to support that in this conversation, I will say that we would ask that association be proven, because right now, largely speaking, that body of evidence is missing from that argument.
And my other question is, I mean, you said this has a significant impact on the entire supply chain, customers included, and what I had heard previously was that the demand for concentrates isn't particularly high. And again, please correct me if I'm wrong. I'm just trying to read my notes here. Why or how does this cap have a significant impact on the entire supply chain?
I'm glad you asked that. Some numbers that we see at the Trade Association, we project, and this is for the most part in alignment with the agency, we see the market to arrive at a several $100 million market. And that means that, well, stepping back, looking at other markets, including our market, intrastate adult use markets, cannabis concentrates typically account for, on average, around half of the marketplace, the market share. And why is that? That's because concentrates is a broad category. There are subdivisions within concentrates. So for instance, concentrates are not just dabs and hash products that are vaporized or smoked. They are also components that go into the manufacturing of other products. So under the category of concentrates, which is a significant portion of adult use markets, there's edibles, there's drinks, there's topicals, there's really numerous products that are produced from concentrates. So when you're looking at market share in the context of concentrates, it is more than just the hash products you can dab, the oil products you can put into a pen and vaporize. It is exponentially more than that. It is impacting cooks, product makers, craft topical makers, the entire supply chain. And as a result, retailers are missing those products from their shelves. If a couple is coming from, say, Massachusetts to visit for the weekend and they're used to seeing products on the shelves in their state, they will not find them on our shelves. I don't know if that was answered your question.
It helps. Yes, thank you.
Do you mind if I weigh in after he's done?
Yeah, after he's done, we can give you some time. We have half an hour, so we've got plenty of time. Did you two have any questions for Jeff? Okay. Jeff, my last question has to do with you stated there's no pulling back. Other states aren't pulling back or anything like that. But we did hear that there are states that are pulling back. So, I obviously in the last 20 minutes, I haven't done my own research to, at a computer or anything. So I don't know what's accurate at the moment. Can you share your thoughts on states that are introducing bills to bring back the cap?
Happy to, and thanks for answering that. Excellent question. One thing to keep in mind is, we do see at times, somewhat, I don't want to say non-serious, but after a regulated market takes hold, it is common to see exponential amendments and bills related to the adult use market, just in general. For example, out in California, after California enacted through voter initiative their tax and regulatory framework, and granted, this is California, there were over 200 bills just seeking appropriations in their legislative session. So within the stack of bills that are coming out of legislative council across the states, absolutely, and I think it's important to address that. We will see, for instance, individual pieces of legislation that are looking to pull back the entire regulated market. We see that in some states. We see that. We see that here in Vermont. So, to speak to be more poignant That's what we are seeing. But I don't think that we should interpret that as a broader movement when there are, maybe 2 or 3 bills nationwide out of likely over 1,000 bills that are being introduced and deliberated. I believe that is the reality here. So largely speaking, when we speak to other states, they see the THC caps here in Vermont as an oversight. It's embarrassing for our industry to speak to other states and have this. There are more thoughtful ways to approach regulation, and we believe it is through regulating products and not keeping them prohibited.
Thank you. Yeah, that definitely, the way you put that definitely clarifies it quite a bit. I mean, we see bills in the House right now that are attempting to repeal the entire Global Warming Solutions Act, but that doesn't mean that there's actually a lot of movement or support or broad support for it. So
I think we have a bill in the House right now to repeal the tax and regulated market of cannabis.
yeah. So yeah, thank you, Jeff. I appreciate that. Jeff, do you have any further testimony, or do you guys have any questions?
No, I appreciate your time. And I look forward to future conversation on not just this bill, but other cannabis related bills. So thank you guys.
Absolutely. Thank you. And just so you know, Jill is going to be testifying again if you want to stick around and listen, because we still have 25 minutes. So
And also we had somebody else who wanted to testify.
we have another person.
Jesselyn, but she's not on.
Jeff, was there somebody who, another person you had testifying or that you'd like to have testify?
Yes, in conversations the other day, we were told that we only had 1 slot available. It seems like more time was sort of available. So I was asking that Jessie Lynn Dolan, who's a registered nurse and co-founder of the Green Mountain Patients Alliance, to offer testimony if appropriate, if there was time.
Yep, we have, so Jill asked to respond, so I will provide some time for that. And then if we have, I imagine we'll probably have 15 minutes after that to, for this other person to testify.
That'd be great.
Yeah, awesome.
I was just gonna say that there's a whole movement.
I'm sorry, can you just state your name for the record?
Yeah, sorry, Jill Hop-Garin from the Vermont Medical Society, but there's a whole movement of families in Colorado that are supporters of the potency cap. And then in Washington, there is, like I said, there's this research prevention subcommittee. So I think there is a larger movement than has been shown, and we can get people to come and speak to that too. They'd be via Zoom from other states, and I'm not sure if that's appreciated or needed. But just to say that this is really an urgent issue. And then also, just to remind you, in last year's bill, or maybe you didn't know because you weren't here in last year's bill, and the VMS didn't weigh in on this at all, but you did approve the ability for product manufacturers to have higher potency if they were going to be putting that into, say, edibles or other products. So I just wanted to make sure that you know that that is allowed, and so people aren't struggling with that at this point. So the product itself that is being sold is under the potency limit, but if you're a manufacturer, you could have, say, 100%, that then you're divvying that up.
Thank you. Did we want to have the nurse testify?
I sent her the link.
Okay.
So I'm not sure.
So Jeff, we sent the link out to your colleague. Remind me the name again.
Her name is Jessie Lynn Dolan.
Jessie.
Dolan. Correct.
Is she planning on joining now, or?
Yeah, let me actually text her. Thank you. Excellent. She said she has the link and she's waiting to be let in.
Oh, okay.
Hello, thank you so much for having me today. Can you hear me all right?
Yes.
All right. Well, thanks again for having me. As Jeff had mentioned, we didn't expect to have a second person speaking today, so I apologize. I don't have any testimony written up for you to give you
Can also just
references.
state your name for the record? I'm sorry to interrupt you.
Absolutely. So my name is Jessie Lynn Dolan. I am a registered nurse. I specialize in opioid use disorder in maternal child health, so mostly in pregnancy and opioid withdrawal for newborns. I'm the president of the American Nurses Association here in Vermont. I'm also the state representative for our forensic nursing program, as well as a patient and a caregiver for another nurse in cancer remission myself in the cannabis program here in the state of Vermont. Thank you for allowing me to speak. As I mentioned, I didn't really prep ahead of time. We didn't know we'd have this extra time, which we appreciate. So thank you so much, but please bear with me. I just kind of jotted down a few notes as to what I'd like to mention. I would like to start again, thanking you for allowing me to have a voice and to testify, but I do want to mention at times it is really difficult for us to have a voice, let alone for patients to come to the table and have a voice. And as Jill just mentioned, bringing in people from Colorado, I'd really appreciate it if you guys can consider opening up some time and space for our local patients. We do have a patient that is supposed to be on the advisory committee, and they have not been for over the last, year and couple of months. So we really are missing patient voices. I'm a research nurse from the University of Vermont. And what I've learned is that we can't always go off our research. As you know, with a Schedule I prohibition, we have limited the research here in this country. And most of our research has been to find the negative aspects of cannabis. So I will reiterate how important it is to hear anecdotal information and to listen to our patients' voices. This past winter, I went to Israel to publish research because the United States would not publish it from the University of Vermont, though it was a follow-up research study from 5 years prior that was published here in the States. But their concern was it showed a tiny bit more support rather than prohibition for cannabis, so it wasn't published. So I think that's just a great example for you guys to understand where the research we do and we do not have. I just wanted to touch on a couple of things that were spoken about so far. You're discussing the potency caps, and two things I'd like to mention. One is that when Jill discusses oil concentrates as far as inhalation, I think there's some confusion and misunderstanding amongst medical professionals, because those oils that she's mentioning are not anything that is combusted or meant to be combusted. Those are internal ingestible oils. They say so on the label and the packaging. I have never met anyone who takes an oil tincture bottle and tries to combust it. And here in the state of Vermont, we do have regulations regarding what we are allowed to add to smokable concentrates to prevent that. So we already have those protections in place. Again, I think it might just be some misunderstanding and confusion among some medical professionals. As you likely know, here in the state of Vermont, there is no mandated continuing education for doctors or nurses. So some of the information doctors have is a bit antiquated. It is not, the endocannabinoid system in cannabis is not part of medical professionals' education, whether they're a nurse or a doctor. And oftentimes we know, again, we're going off the research that was purposely trying to stigmatize this plant. The other thing I want to mention regarding that is when we look at concerns for intoxication or mental health detrimental effects, we really need to understand terpenes. So if we have medical professionals advocating to cap THC at 30%, but not discussing terpenes, that is showing that they don't have the understanding that they need to protect our public. There's a research article that recently came out from Ethan Russo, who is one of the top world neuroscientists for specializing in cannabis. He developed Epidiolex, which is that prescription CBD medicine that for children's seizures, if you guys know that medication I'm speaking of. He recently put out information stating we are doing a misservice and irresponsible as medical professionals if we are not looking at terpenes based on intoxication levels. So what that means is 30% THC likely only has 1% terpenes in it. We can have 15% THC with 4% terpenes in it. That can get you much more intoxicated and give you a very different effect than 30 to 35% THC. And if we have a medical society advocating and not discussing that, again, I would love to see more formal education and a deeper understanding around that, because there is now the research proving that, though we've had the anecdotal patient feedback for centuries. So again, we need to listen to our patients. The other thing I want to continue to mention about concentrates is that I too felt very stigmatized and was very against concentrates. I'm the mother of children. I have several children, some 21, who actually has an adult use medical cannabis card. I have younger teenagers in the house. I'm the last person that wants to put anyone in danger. I worked at Lund for a long time. I'm the biggest advocate for keeping people healthy and safe and not using substances. But we need to understand what we're talking about. I work with a 70-year-old woman who helped to break my own stigma when she told me, I have to smoke hash and I take 2 hits to have a bowel movement. If not, I'm in excruciating pain and might have to call an ambulance. She does not have time to smoke an entire joint, and her lung capacity cannot handle smoking an entire joint. But 2 hits of hash and she is medicinally able to do what she needs to do for her body. I needed to hear that information. She will testify for you if you listen to her and allow patients to testify. Those are the stories you need to hear to understand why we should not have a THC cap and why a THC cap is detrimental to our consumers, and how that THC cap is also going to send people back to the illicit market. Because I have had elderly folks tell me they will go back to the illicit market if the programs and the adult use does not have what they want, because no one wants to drive an hour and a half from Newport to Burlington to get their medical cannabis when they can drive 5 or 10 minutes up the road if that store has what they need. I think we all recognize how, challenging that is for patients to need to do that traveling. So the other couple things, and again, I apologize, I'm just kind of going off notes. I didn't have this prepped and typed to hand you as I normally would. And, as with the American Nurses Association, Vermont, that's definitely how we try to give it to you as well. So again, just bear with me. I'm going to finish up because I appreciate the time. But I do, also want to mention comparing this industry to the tobacco industry, I think is a little disheartening. We know that this industry does have medicinal support and use and research behind it. We also know, and if you don't know, I would love to, again, bring patients forward to explain this to you, to hear from them. There are people who use medicinally, but are not comfortable putting their name in a registry to do that, or have a medical care provider who has taken education around the endocannabinoid system to understand and meet them where they're at, regardless of their own bias and stigma and lack of or negative enforced education around cannabis. So please just keep that into consideration as well. And lastly, we talk about regulation versus prohibition. I worked at Lund for a long time. If you know that, I dealt with a lot of teenage pregnancy. What we know is that abstinence, unfortunately, throwing that at our children and our public space has not been the answer. We know we need to regulate and support and educate instead of prohibit this medicine or this plant, this substance, for people to have this option. So if we can consider regulating and increasing education, which we have a lot of money being laid out to help educate, and not just educating individuals, but we need to educate medical professionals as well and have that as an option. So again, please look at regulating and working with the industry. Abstinence did not decrease teen pregnancy. We know that. So prohibition is not always the answer. We're past prohibition. We need to work together to regulate that. And lastly, we talk about increasing the allowable dosage in one package. So increasing that from 50 milligrams to 100 milligrams. And I absolutely agree that in most states, unfortunately, when adult use legalization does happen, we do see an uptick, or we do see some children and elderly folks as well going into an ER for cannabis ingestion. Again, if we look at education, that's how we prevent that. And we don't prevent things from a fear-based perspective. So that 100 milligram package, we also have to not only consider consumer safety, we have to consider people's affordability and whether that package is then going to be more expensive. Can they actually keep themselves safe? Of course they can. This is responsible consumption. We don't have a any child-proof tops on vodka or on beer, and we allow that as well. And what we do know is there are fatalities in children around alcohol. We have not seen fatalities around children or anyone with cannabis. So please, let's take this out of that kind of tobacco and alcohol mindset, because we do have some very solid research showing medicinal benefits. And I think we can all recognize that not everybody feels comfortable being a medical patient in the medical system, or admitting for whatever reasons, whether it's their own job or child custody or the stigma that unfortunately we have put in place. And some of these, by continuing some of these prohibitions, we're continuing to put those stigma in place. And the one thing we are doing is putting our consumers at risk by not allowing them to feel comfortable to have the open conversations. So when we do that, we are doing the opposite of what everybody here today and everybody in the state of Vermont that I've spoken to wants, is a regulated, supported, and educated system that is not prohibitive and not fear-based, so that we can take control of this and really make this move forward to help everyone here in Vermont. I hear time and time again from people around the concerns of lack of education, the concerns of lack of testing. And I would truly hope, and I appreciate all the work the Vermont Medical Society has done, but I would really love to see you also advocating for consumer safety through our medical program being mandated lab testing. No one's talking about that. Mandating terpene testing to understand intoxication. No one is talking about that. Subsidizing that lab testing for patients and caregivers. No one is talking about that. So I understand many of the points the VMS is bringing forward, but I also think they are needing a little bit more education and understanding themselves, and to maybe find some other areas where we could use them on our side to rally, to really make more support for some of our patients and consumers here in Vermont. And lastly, I would just say, as I mentioned, I appreciate you guys letting me speak today. Just so you know, it is oftentimes a struggle to allow us to be able to speak and come forward. And I would really hope you think about allowing other patients to speak. I know you're going to give Jill time again to, speak after we do. And again, I would ask kind of that same respect and mutual coordination, that if there's a medical provider there, we either have another medical provider like myself who will speak more to the patient's anecdotal and want to support consumers, whether that's, a patient or just a Vermonter who doesn't have a medical card, and not just look at the prohibition. How can we work together to make that happen? So I appreciate your time, always open to questions, and would love to actually put this together a little more organized at some point. Tuesdays are my really heavy, Tuesday and Wednesday are my heavy clinical days, so I haven't had time to put anything together and just kind of jumped in last minute. So hopefully most of that made sense and wasn't too all over the place, as I wasn't able to kind of coordinate it in order, but open to questions, would love to chat with you again, and would absolutely love to help bring patients in specific to any topic you would like to hear a patient's perspective, and how important, it is for us to hear from our Vermonters and our consumers. So thank you.
Thank you, Jesse. I really appreciate your perspective. Just to clarify one point, this is our first walkthrough of the bill. We don't have a schedule yet per se of who we're hearing from next week for the bill. So, certainly hearing from Vermont patients would, that's, I see the value of that. So yeah, just want to let you know, we don't have, we don't have a witness list ready for the next session, but it's definitely something we'll be developing. Are there any questions for you guys?
She gonna send us something on her testimony, or?
Jesse, is there anything that you also want to send, any research or paperwork or documents that you might want to send, any written testimony or anything?
We don't have anything at the moment, but I could definitely pull stuff together. If there's anything specific you're looking for, please also let me know. What I've found as both a research nurse and a consumer is every article you find that's pro, you can find one anti. And we really need to figure out who's creating those research studies and what the hypothesis is. When I worked at UVM, I was told you document according to your hypothesis. So that's not what we want to hear when we really want to understand the crux of everything. So again, if there's anything specifically you want, please let me know. But I do a lot of kind of digging, and For every pro study we find, find something anti. And as Jeff had mentioned before, we really haven't been able to come up with a lot of the concrete information we want. There's a lot of conflicting research out there, unfortunately. So again, when that happens in my mind, I go right back to my people and I listen to my constituents and my Vermonters.
Senator Norris, was there anything specific you wanted to say?
No, I just wanted to look a high level, something on what you just testified today, Jesse.
Maybe bullet points.
Absolutely.
Synopsis, yeah. And if you know, from where I'm sitting, if you have any research regarding the correlation or lack thereof regarding removing caps and mental health, or folks visiting the ER or anything like that, that research would also be appreciated.
Absolutely, but please just keep in mind the one research study that everyone goes off of regarding human milk feeding or breastfeeding in cannabis is based on 8 patients, and that's the only research study everyone in the world is going off of at this point. So just to kind of keep that in mind for us.
Good to know. Thank you. Anything else from either of you? Great. Well, thank you very much. I'm glad we had the time to have you in, Jesse.
Thank you.
All right. So I guess we can conclude a few minutes early.
Jesse Lynn Dolan.
It's on the agenda.
On the agenda.
So we're gonna take a break.
Yeah, we can break until 10:45 and then we come back for